Hello everyone, welcome back to my YouTube channel. Today we are going to talk about pulp necrosis. We will start our topic with introduction. Pulp necrosis is death of dental pulp tissue that is often the final stage in progression of untreated or severe pulpitis. It is a pathological condition that results from ischemia, inflammation or trauma leading to complete loss of vitality in the pulp. Once necrosis set in, the pulp can no longer recover and treatment becomes essential to prevent spread of infection. Now let's talk about the definition of pulp necrosis. Pulp necrosis is the complete death of pulp tissue characterized by the absence of blood supply and nerve activity within the pulp chamber and root canal. Talking about etiology of pulp necrosis, it may be caused by untreated irreversible pulpitis. Severe dental trauma, especially luxation or avulsion, can also cause pulp necrosis. Deep dental caries reaching the pulp can cause pulp necrosis. Cracked or fractured tooth, thermal or chemical insult from dental procedure can also lead to pulp necrosis, and restorative trauma or repeated dental work on the same tooth can also cause pulp necrosis. Bacterial invasion is also the cause of pulp necrosis. Now let's talk about pathogenesis of pulp necrosis. When the pulp is inflamed beyond recovery, blood flow becomes compromised, and this compromised blood flow in the enclosed nature of pulp chamber prevents the release of pressure, leading to vascular collapse. As a result, there is ischemia and cell death and tissue breakdown. Necrotic tissue becomes a medium for bacterial growth, which can spread of periapical tissue, resulting in periapical pathologies like abscess or granuloma or cyst. Now let's talk about types of pulp necrosis. Pulp necrosis may be coagulative necrosis when tissue architecture is preserved, commonly in ischemic injury, or it may be liquefative necrosis, that is complete disintegration of pulp tissue and pus may be formed in this thing. There is clinical features of pulp necrosis that may be asymptomatic, especially in early stages, and tooth discoloration like gray hue due to hemoglobin breakdown products is one of the feature of pulp necrosis, and it has no response to thermoelectrical pulp tests that represent that pulp is dead. In some cases, pain on biting and percussion is there, especially if periapical tissue is involved, and swelling or abscess formation infection is extended can also be seen in radiographic features. History of trauma carries or previous pulpitis is common in these patients. Now talking about pulp vitality test, if we do cold test, there is no response of the pulp because the pulp is dead. In case of electric pulp test, there is no response, and these results should be correlated clinically and radiographically, especially in teeth with immature abscesses or trauma. Now let's talk about radiographic features. The radiographic features of pulp necrosis may show periapical radiolucency that indicate periapical inflammation or abscess. Internal root resorption may be seen in some cases. Loss of laminar dura or widened periodontal ligament space may be seen. Advanced lesion may show periapical cyst or granuloma. Now let's talk about histological features of it. There is absence of living cells in the pulp tissue as there is necrosis. Disintegration of odontoblast layer is there, and then there is presence of necrotic debris, bacteria, and sometimes pus is also there. Fibrosis or calcification may be found in chronic cases. Now let's talk about diagnosis of chronic pulp necrosis. It is based on history of trauma, deep caries or pain. Second, we do vitality test that has no response to vitality test in case of pulp necrosis. Third, we do is radiographic evidence of pulpar or periapical change, and clinical symptoms is also there that include discoloration, sinus tract, and abscess may be there. Now let's talk about management of pulp necrosis. Necrotic pulp must be removed and the tooth disinfected to prevent or manage apical infection. The first thing we do in the management of pulp necrosis is root canal treatment. That is standard treatment that involves removal of necrotic tissue, cleaning and shaping of root canal, and disinfection and obturation. The second thing we do is extraction, that is for non-restorable teeth and patients with declining root canal treatment. And we can also do epexification or regenerative endodontics in immature tooth. With open abscess, traditional or CT can be challenging, so we do epexification or regenerative endodontics. Epexification is using material like calcium hydroxide or MTS done to induce apical barrier formation. Then we can also do regenerative procedures that aim to stimulate tissue repair or regeneration. Now let's talk about prognosis of pulp necrosis. It is good with timely and proper endodontic treatment. If untreated, pulp necrosis can lead to chronic periapical abscess, osteomyelitis, cellulitis, and fistula or sinus sac formation. And the spread of infection to facial spaces can cause systemic circulation, and this thing is serious. So this was about chronic pulpitis. Hopefully you liked the video. Don't forget to like, share, subscribe, and